Ashley. I'm going to be your nurse today. If my patient is of age, I would explain the procedure to my patient or to the parent. We're going to be inserting an NG tube so you can get tube feedings and medication. And I have a physician's order for that. So I would check based on the MAR, and I'm going to make sure that this is my right patient on the ID band. I would have my equipment the right size and G tube for the patient and gloves. Okay. So I would want to assess my patient to see which nair it should go into. If they're old enough, I can plug one and have them breathe and see which one seems the most clear. Do this one for demonstration purposes. So I would take this out of its packaging if it was new, and then to measure, I would want to go from the tip of the nose to the pinna, and then hold it, and I would want to go down to the xiphoid process. So I'd want to tape where that is so I know how much I would want to insert. I'll say it's up there because it doesn't go into that dummy. Okay. So then if I had lubricant, I would lubricate the end so it would slide in easier, or also via the CHO policies and procedures, I could dip it in water and get it wet and then shake it off. So I want to, if my patient can understand, I want to instruct them to warn them that I'm going to do this. I want to have them in a high Fowler's position, or if they're an infant, I can have their parent holding them and restraining them, or another nurse possibly. So it's lubricated. I want to insert it until I hit the gag reflex, and then I'll pull back a little bit and have them put their head down, and then ask them to swallow, or I can give them ice chips that they can chew and swallow to help too while I insert it. If I felt resistance, I would pull back and try to rotate it and get it in there. Or if it was coiling, I would pull back and rotate, and then if it still didn't go in, I would not push it in any farther, and I would call a physician. So the policies and procedures that Children's Hospital say to tape it to their cheek using Tegaderm or tape. So since we don't have Tegaderm, I'll just use tape. And it would, in theory, stick to this mannequin. Oh my gosh. Let's just pretend it's on there because the tape's not sticking. So now to check placement, you would always want to have an abdominal x-ray to verify it, or using this MI stethoscope. I would listen over the stomach while I push air in, and I would want to listen for a gurgling noise to make sure that it's in the right placement. And then I can also aspirate gastric content to make sure it's in there. And I always want to recap the end. So after he is all inserted, the tube feeding protocol, I would again verify that I have physician's orders for it, and check my patient ID band, The formula, based on what it is, if it's formula or breast milk, it has different hang times. The formula, I think, is 4 hours, and then, so yeah, I would fill it and prime the tubing. And then before connecting, I would recheck the placement of my tube with my stethoscope in the air or by aspirating gastric content again. And then, and per the hospital protocol, I would also aspirate for residual if they had feedings before that, and if it's more than 1/4 the original feeding, then I would not administer the next feeding, contact the physician. But in the CHO policies and procedures, it says 1/2, so depending on what you're going on. So then I would, after I verified placement, I would clamp this. So I would, oh my gosh. Can we stop for a second? If that was in, it would be connected. I would start the pump, and I would set it to whatever rate the physician ordered and start it. While the feeding is going, I would assess my patient's respiratory condition and their coloring to make sure that they're not aspirating any of the feeding. And then after the bolus dose is done, I would disconnect it, clamp it, and then I would flush with the appropriate amount of sterile water. If it's pediatric, it's 3 to 5, and if it's infant, it can be 1 to 2. So I would flush some water in there, and then I'd leave it clamped, and just leave it. I can tape it to their gown or up out of the side so they're not pulling it. And then I would document everything about the procedure and how they handled the feeding.